Welcome to tonight's live town hall. Don't we talk about mental health issues? Sponsored by St. Agnes Medical Center and Kingsview Central Valley Suicide Prevention Hotline. Here's your host, Liz Gonzalez.
Good evening, and thank you for joining us tonight for a very special discussion, a discussion that we don't often have, but we should, and that is a discussion about mental health. A poll in November by the California Healthcare Foundation found people rank the lack of mental health providers second when it comes to extremely important issues in our state. It ranks just behind improving public education. We have a wonderful panel that is joining us tonight, eager to answer your questions so we can get this conversation going and hopefully get some people in the right direction, provide some answers, or at least get that conversation started. We're going to start with introducing the panel tonight. We're going to begin with Christina Roop, who's the Executive Director of NAMI Fresno, or the local affiliate of National Alliance on Mental Illness. She is certified in crisis intervention training for law enforcement, and she is certified instructor for adult and youth mental health first aid. She also supports mental health training and education support for law enforcement agencies, the criminal justice system, local school districts, including teachers, administrators, and students, and our faith communities. Jerry Silva is a licensed clinical social worker and works in the VA's mental health service as its lead suicide prevention coordinator. Jerry's career in mental health has spanned more than 26 years, and in his current role, he has served the last 7, overseeing a team that's working towards suicide prevention. Thank you. Trina Frazier is the Chief Student Services Officer at Fresno County Superintendent of Schools. She oversees the behavioral health, special education, and special education local planned area departments. She has served as a classroom teacher, a school psychologist, and district special education director. She has 27 years of experience providing expertise in the areas of special education, program development, pupil personnel services, behavioral health, and budget management. Thanks for being here. Amanda Nugent-Divine is the Chief Executive Officer for Kingsview Behavioral Health Corporation. She is licensed as a marriage and family therapist in the state of California, and I say state of California because she's also a licensed professional counselor in the state of Texas. She has extensive experience working as a clinical director in both mental health and substance use disorder treatment. She's also an expert consultant for the California Board of Behavioral Sciences. And Christina Alejo is the program director for the Holistic Cultural Education and Wellness Center. The organization addresses mental health issues from a cultural and ethnic-focused wellness and recovery approach. She has worked with traditionally underserved populations for the past 25 years and is the co-founder of Mental Health America of the Central Valley. She's working to expand behavioral health services and outreach to U.S. veterans. Thank you so much for joining us tonight. At the bottom of your screen, you'll notice that we do have information, phone numbers there. These are different resources that we want to provide you, along with also providing you a number where you can text your questions to our panel tonight. Before this even started, we released a number earlier to you today on Great Day as well as other newscasts, and I can tell you that plenty of you have already had plenty to ask, so we'll be getting to those questions in just a moment. But if you do have a question for our panel that you'd like to raise, the number to call, or the number to text, excuse me, this is only for texting, is 559-426-6474. Again, 559-426-6474. One thing that we found in doing research before this discussion was just that the Central Valley is severely underserved when it comes to when it comes to people getting the help that they need. What is behind that? Any of you want to tackle that? We'll just go and start with you. Thank you.
We're unclear exactly why there is a shortage in this area, but as far as resources go, we know that part of the issue is access to mental health. So we have providers, we have people who are ready to care for people, but the access to health care is proving difficult. That may be for reasons of insurance coverage, it may be reasons for education, fear. Lots of people have fear of getting treatment, that it will impact their job negatively, or it will cause them difficulty in their families or with their relationships. So we see that happen more here in the Central Valley as far as accessing resources. Access is a big issue.
Now, when it comes to our kids, Trina, what are you guys finding as well? Is the shortage there as well when it comes to children as much as it is for adults?
Yes, we are finding a shortage. We currently have a partnership with Fresno County Behavioral Health, and it's a 5-year plan to provide services to every school in Fresno County. And but we're finding that schools are lacking these types of services, and we started on January 7th, and so they're really, really excited about having these services in schools. But yes, we still are finding that there are shortages and issues with access.
One thing we don't have a shortage of course, tonight is thankfully the questions from you at home, trying to get some help, trying to get answers, or at least get pointed in the right direction. Our first text message question that we received tonight is this, a very serious question. Our son has mental illness and he hears voices telling him to cut his family's heads off. Should I really worry that he will really do it? I don't trust him living in our home anymore. My wife and daughter don't think he will hurt us, but what should I do? Please give me your opinion. Anybody want to start?
I think it is very important to seek help in this situation. We currently have a hotline, which is 443-4800, and also a website. It's called All for Youth at fcoe.org, and we take referrals all the time. I mean, we take them every day. We take them in the form of submitting them in a paper form, going on the website, filling them out via the fillable form. You can make a referral at your school, but yes, I would definitely make a referral.
Now, if they are not from Fresno County, again, our viewership ranges from Merced down to Tulare and Kings counties. Do they need to get a hold of their local school district for questions if it is, in fact, somebody that is underage?
Yes, I would get a hold of your local school district in this case.
Okay. My next question, Christina, I'll ask you this one. Somebody asked, simple question, does bipolar disorder ever go away?
Mental illness, we know, is not a curable illness to have. However, with the appropriate treatment and resources available sooner than later, the symptoms can be managed and one can live in a very healthy place of recovery. To say that it would go away, I would describe that as the same as having symptoms managed and living in recovery. But they will always live with that disorder and will need treatment for that. In various ways, and it depends on the individual what that treatment will look like.
Okay. Next question, and this one goes to any of you. Somebody asked, can a mental health disorder be caused by incidents that happened to you as a child? What are things to look for to know if you have a mental disorder?
We know that many of the mental illnesses, there are many reasons as to why someone can develop a mental illness. We know that there's brain chemistry that can be involved. We know that genetics play a role. We know that stresses in our environment play a role. And one of the reasons and the homage that we pay to stress in our environment is ACEs. It's actually a scale that we try to address childhood trauma. And we take an assessment of how much trauma did an individual experience in childhood. And we know that brain development is impacted by trauma in childhood, that it actually can change the course of developing. We know that the brain continues to develop till you're about age 24 or 25. And we see that trauma negatively impacts that. So to answer that question, trauma plays a big role in mental illness. And it plays a role and it combines and compounds the issues that we see combined with genetics, combined with brain chemistry, and other things that can, if someone is predisposed to having a particular type of mental illness.
Anybody else? You mentioned.
Well, there are in the ACEs study that they did, there are 10 types of trauma that a child can suffer until the age of 18. And that actually, if they don't deal with it and learn to cope, it can have an adverse effect on their entire life. So it can affect their health in ways. It can cause heart disease. It can cause diabetes. It can cause a lot of those different things. So as you said, it's very important to address trauma and to seek out help and to learn how to cope with it, to build that resilience so that you're able to get over those obstacles and move on with your life. But yes, it does have an adverse effect on your whole life.
Again, the topic of tonight's town hall, if you're just joining us on Fox 26, KMPH.com, or the Fox 26 Facebook pages, why don't we talk about mental health issues? One group in particular that is very affected by mental health issues and yet may not be comfortable talking about the situation or the cases is the military community. We have so many veterans that are coming back, so many veterans that are younger and younger every day. Jerry, can you tell me about what you run into and what it is that is keeping a lot of them from really wanting to talk about it. People have family members who are even Vietnam veterans who just don't talk about it.
When we look at mental health issues and we look at our active duty military personnel as well as our veterans, we have to look at it in terms of the way we might receive an email with a subject matter that says mental health. If we get an email that always says mental health, there's always going to be a word attachment with that. So right off the bat, from a veteran standpoint, the initial attachment is always weakness, less than, worrisome, criminal, not as good as. All of the things that might be negatively attached to what's completely opposite expected of our strong young men and women to go into the military and serve for us. So for them to come back, over the years, I've had so many military men and women tell me, I've got to come back now, and I've got to share with you guys the difficulties that I'm experiencing. Not a bad day at work, not a bad breakup in a relationship, but the very serious symptoms and severity of depression, post-traumatic stress, anxiety, you name it, at a level that's never been seen before by many of my coworkers or clinicians being in the field for all the years we've been in the work. So to come back to even to broach that subject of mental health struggles and even to discuss that, it's considered a big no-no. I just simply cannot talk about that because that would mean I'm a weak man or a weak young lady. So that even to discuss it is very, very unheard of. So we've got to make a lot of long strides towards softening that up a little bit and making it okay to say, you know what, it is okay. It actually takes more strength to discuss that. But yes, it is a big challenge list for us to kind of get into that.
Are there things that family members need to be looking out for to maybe try to approach them about it? Or, hey, you did this, that sort of makes me wonder. Or, hey, maybe join the VFW post, join where you can really get to talking with others that have that shared experience.
Yeah, that's a good question. As family members, as friends, as loved ones of veterans who've served, one of the things we want to look at right off the bat is the disconnect or isolation. Many of our veterans come back, they make it clear to us at the VA, they make it clear to very, experienced mental health providers, look, dude, I'm good. Leave me alone, I've got this, I'm going to be okay. Just let me stay at the house, do my own thing, leave me alone, I'm good to go. And the fact is, the more we see isolation, disconnect, the symptoms of PTSD or depression go right on up. So when you start to see that, we need to pursue them and do so with loving gentleness is what we call it, to say, hey, I'm going to have to get you plugged in for a little bit extra care. And if it's not me who you want to talk to, I'm going to get someone, because we're going to start seeing people who want to self-medicate. I'll be okay, let me drink or do some drugs and I'll be okay. Well, we all know those are very unhealthy coping skills, and the more immediate we get our loved ones plugged into care, the more we can help, because we have seen now what happens when we don't get them plugged in for care, what happens to those untreated mental illness, how we start to see people at risk for self-harm, and we know the staggering numbers that go along with suicides, completions amongst veterans.
Just to add, as far as veterans go, for men in particular, but also veterans in general, depression looks very different, and we see that in youth as well. Depression looks different in youth, and it looks different in men. When men are depressed, there's actually evidence out there that shows that they are more likely to come across very, very irritable and angry. And so we see that a lot with our veterans actually showing anger, which then is very hard for a family member to say, I think you're depressed, because that does not ring true for them, right? So, and to be depressed, as you said, has the stigma attached to it, in addition to the fact that it actually has real negative consequences in the military culture. It is not okay in military for your position for you to be depressed or have a mental health issue. And so that's why it is so hidden, because it can be the end of their career. And so part of the work we have to do is actually change our military culture.
When we're talking about military service being one thing that gives people a lot of pride, so much that they don't want to consider it a sign of weakness that they are depressed, another thing we see is also culturally speaking. Christina, I'm going to have you discuss this a little bit, because you work with underserved communities, Latino, Hmong, communities that oftentimes we don't talk about this. Oh, you'll get over it. Oh, just drink some tea. And that's that. And it goes beyond that sometimes culturally people don't want to recognize it.
That's absolutely true. So one of the conversations I had before coming here, I always want to make sure that I'm not just speaking for myself, but that I'm speaking for the communities which we serve. I spoke to my cultural brokers, and you're right, we represent different cultural groups, Lao, Hmong, Cambodian, Punjabi, and I asked the question, why don't we talk about mental health? And the reasons are so common sense. There's stigma attached, there's fear, there's the belief that the services aren't really there for me. The environment in which services are provided is often described as sterile, unwelcoming. Somebody shared an experience in which they finally were, and these are their words, brave enough to seek mental health help, and they were put in front of a monitor. We call it telemedicine. They took it as disinterest. This person didn't even care enough to show up. They put me in front of a monitor. I learned so much when I was able to teach mental health first aid to our Khmer veterans. They were there requesting the class because they said, our community comes to us because they feel like we can fix any problem. They identified themselves as first responders, and they took it upon themselves to come and take mental health first aid because they were having so many people approach them and they didn't know what to say. And I asked them, what would you want people to know about being a veteran? Because you need understanding too. And part of what they shared is that people need to understand that the same things that kept them safe when they were at war are the things that now keep them separate from their families and friends. They had to be vigilant. They had to learn to shut off their feelings. They had to learn to get through it. And now they come home and they're expected to be different, right? So I thought that was a wonderful learning experience.
Okay, we want to encourage you at home to continue to send us your questions, text us your questions to the number that we've been providing you, 559-426-6474. We're going to be touching on a number of different topics. We discussed veterans. I'm going to even bring up the issue of postpartum depression because sometimes we think it's just something that's so simple. A doctor asks you if you're okay and you say, yeah, and that's that. And maybe there's a little bit more digging to do below the surface. But again, we want to thank you for joining us tonight. And we want to remind you that at the bottom of the screen, there are a number of phone numbers that we are providing, different resources that you can call. If you have any questions after this is over, we will continue to go until 7:30 over on KMPH.com until 7 p.m. on Fox 26. We'll be right back.
You're watching tonight's live town hall meeting, Why Don't We Talk About Mental Health Issues, sponsored by St. Agnes Medical Center and Kingsview Central Valley Suicide Prevention Hotline. We'll be right back. Welcome back to tonight's live town hall meeting. Why don't we talk about mental health issues? Sponsored by St. Agnes Medical Center and Kingsview Central Valley Suicide Prevention Hotline.
Thank you so much for joining us again. We're back at our town hall titled, Why Don't We Talk About Mental Health Issues? One of the big reasons why we decided to do this town hall is actually coming back to the subject of education. Specifically, the Fresno County Superintendent of Schools, Jimmy Ovino, mentioned that he really wanted to make this an issue that he was going to really push for when it came to this next administration that he's serving. And in fact, we are fortunate to have Mr. Ovino with us. Thank you so much.
That is exactly right. Thank you so much for joining us. And back to that point, in your swearing-in ceremony, you made mention something to the effect of children actually don't have very much of an issue discussing mental health issues, but surprisingly, their parents or other adults do. What is your initiative to try and tackle that and expand the resources for our students?
Sure, I think it's twofold. One, when folks have issues of, whether it's diabetes or heart disease or cancer, what do? We lean in towards them. We want to help them. But when people are very reluctant to talk about mental health and talk about behavioral health issues, and that just needs to stop. We're at a point now in our community where we have people, we have resources, we have services, and we need to let our adults know that this is a conversation that should be happening. If we want a healthy community, we need to talk about it, and that's what I'm really excited about and what we're going to be doing. And I know it was mentioned earlier, but we are going to have a behavioral health clinician assigned to every school in Fresno County over the next 5 years. It's a 5-year build-out. We'll have 200 clinicians assigned to every school. So when that child needs services, and when I say the school, it is from birth to age 22. So in our partnership with the Department of Behavioral Health, Fresno County, we will be serving our communities, and we'll be serving them where they are. When I say Fresno County, from downtown Fresno, it could be 50 miles. For a lot of our families, 50 miles might as well be 1,000,000 miles. They can't get their child here. So our services are going to be right there on the schools. And we're really excited about what that's going to do and how it's going to change the landscape for our community.
Fantastic. And how did you determine that age range to go from birth to the age of 22?
Yeah, well, we have a lot of research around birth to age 5. We do a lot of work in that arena. But naturally, looking at our school settings up to age 18 and then beyond to age 22, it just made sense for us. And then we're also partnering, again, with Fresno County Behavioral Health. They're still going to be partners with us in this process to also serve the parents of children, because it's not only the child that we're talking about, we're now talking about serving the family.
So this is going to be a plan that's going to roll out in the next couple of years. Yeah. What are going to be the next steps right now to get that rolling?
Well, right now we've picked and identified certain schools in Fresno County to start. We started on the west side of Fresno County, and then we're moving our way back across to central and south side of the county until we include the entire Fresno County. So it's 32 school districts that'll have clinicians assigned not to the districts, but at the school sites.
And why is it so important to have that assistance immediately available at each individual school rather than, as you mentioned, having to make that long 50-mile commute?
Well, I think, our staff can identify the needs of our children very quickly, and we're able to do that, and we have the resources right there at the school sites. Like I said earlier, it just doesn't make a lot of sense if we think we're going to get children to drive 50 miles or their families to take them there. We can serve kids right where they are, and they're in our schools every day.
Excellent. Thank you so much, Mr. Ovino. We appreciate it. Thank you.
All right, thank you so much. Again, Superintendent Jimmy Ovino, Fresno County Office of Education, and Kimberly Colliner, who is helping us this evening as well, taking questions from the audience. Again, we want to remind you at home that you can text questions as well for our panel here. The number is 559-426-6474. Again, the topic of tonight's town hall is why don't we talk about mental health issues? A very, very basic question that, why not just get right to the nitty-gritty of that question? I'm going to start here with Christina. Why don't we talk about this stuff?
I think one of the biggest challenges we have is we don't know what to say. we've always been raised for many, many years that talking about your personal problems isn't always a good thing to do. Keep things to yourself, keep your troubles to yourself, because other people have their troubles. It's also very, when you don't really know what's happening, it's frightening to reach out to someone. You don't know if that's safe space to talk to somebody. You don't know if they're going to understand or if they're going to pass judgment about what you're doing, if there will be blame. Often we see that with family members. You're not doing it right. You're not setting enough boundaries. You're not disciplining well enough. You're not loving them enough. And when it comes to mental health challenges, it's not that simple. It really can be very complicated. Not knowing where to go is another reason, not knowing where to step into the system. And while there are many, many resources available, it is difficult to navigate. I want to honor the families who are in this system, who've been navigating it for years, trying to find care for their loved ones, going from door to door with resources and it not being the right one or not being appropriate or effective enough. And so it does make you sometimes just stay to yourself about it. Only with education and support for each other will those family members and loved ones learn to become advocates for everyone else.
And again, you alluded to confusion. Just yesterday, we had a story in our newscast about Dennis Cochran, who's a gentleman here in the city of Fresno. He's in his 70s. His wife was 60, had bipolar disorder, and she started having hallucinations. She started seeing things, talking to people who weren't there. And he took her to the emergency department at least twice and got sent back home. A lot of people may be in that situation of, I'm not sure if I can't reach a therapist, where do I go? And this is happening more often when it comes to older people.
Yes. And one would think when your brain is sick, you go to an emergency room, you go to a hospital. Unfortunately, our hospitals are not always prepared to handle a psychiatric crisis, a psychiatric emergency. But getting to the appropriate resource, if you don't know the system and where they are, it is very, very difficult, and it can lead to something very, very tragic and sad.
So what happens in that situation if a lot of people have parents living at home with them? If you find that something is off, what should be your first step? And this goes to any of you. Maybe, I don't know if, Jerry?
I think one of the things we always want to do is you always want to start it with your primary care physician, a doctor. I think everything we're discussing here always starts with a general medical checkup.
It's the only way insurance will pay for some of these things too.
Correct. You want to get it covered, get your doctor to see whoever that loved one is first. Let's rule out any medical concerns first, and if there are existing mental health conditions, then we can refer out for psychiatric care at that point. The other thing I would add here locally in the community here is we are very, very challenged here socioeconomically. The other thing is a lot of times, unfortunately, what you just described was very tragic and sad. But one of the things I would encourage everyone to do is to be very, very persistent. Be strong advocates for your loved ones, especially the elderly, and just keep pursuing care, because at some point they're going to have medical and mental health attention paid to them, because obviously they're in need of that. So be a strong bulldog kind of advocate. I would encourage that, definitely.
Yeah, in fact, the study that I had cited earlier found the rates of mental illness are higher at lower income levels for both children and adults. Anybody else want to chime in on that? What should be your first step? Christina.
What I'd like to talk about is some of the additional challenges and barriers in taking that first step. Some of our communities of color that speak a different language, we talk about mental health and we talk about mental health services and we talk about advocacy for mental health services, but some cultures don't even have a word for mental health. And so how do you talk about mental health when there's no word for it? So, for example, I spoke to someone who was Hmong today and someone who was Lao, and I said, how do you say mental health in your language? And they said, there's no word for it. There is, the only word that translates the closest is a word for crazy, which is a negative word, right? We don't want to use that. And so they say, well, how can you talk about something when you're being offensive when you ask about it, if you make a literal translation? And so the way that they talk about it is oftentimes in descriptive terms. So they may be describing symptoms. I don't feel like myself. I don't feel like going to work. I don't feel like going out. They may be telling you that they're having mental health struggles, but they're not using our terminology to describe it. So it may get missed even when they go to the doctor. I would recommend that as a good first step as well. But often if we don't say the right words, then we don't get to the right place, right? And the other fear too is that people talk. Information is shared among community members, and it takes one person being 5150'd, right? It takes one person being taken somewhere to create this fear in community that if you call and ask for help, they're going to put you in a padded room. They're not going to let you see your family, and you don't know what's going to happen. And so there's all these additional fears on top of having a conversation with limited words to describe what's going on.
Okay, we do have a question from our audience. Kimberly?
We're here with Sue Atkins from Selma, who actually has a question about resistance to taking prescribed medication. So what's the personal experience you've had with that?
Well, for the last 24 years, when my daughter got out of the military, she had a mental illness. She went in and did military service basic training in the Army. She got out with the mental illness, but got into the Marine Corps, did basic training in the Marine Corps. They got her out. This is my package. This is from the military. And this is yours. I appreciate all of you. You're right on what you've said. And it's a catch-22. My daughter's 56 and won't take her medicine. She thinks they're killing her. She won't have anything to do with different cultures after she was in the military, different things of bad that happened to her. And so now we got her off the streets. We put her in a home, one of our rentals, so she can pay $400 a month and try to stay off the streets. But my question was, first of all, I'd like all of you, if you haven't seen it yet, please watch a documentary that a lady, sister did of her sister. It's God Knows Where I'm At on Netflix. Have you seen it? No. Do any of you have a mental child, a relative, or someone? Oh, you do? Very good. I'm just wondering, how do you stop the catch-22? My daughter finally, after they take the medicine for so long a time, they think they're well. I had to help her. The military wouldn't help her. They were going to help her, but with her mental, she couldn't fill the papers out. She'd fill them out correctly, and then she'd go back over it and say, I don't have a problem, and cross it all out and say, I don't have a problem. After 2 years of that, the military said, we can't help you because of your paperwork. Well, duh, she can't fill out paperwork. Even the military, Mr. Flores, that I spoke to up at the VA, he tried to help her.
So the question is, how do you
Stop her? Or she won't take medicine. She won't go with me to counselors. She won't. In the last 4 months, she's been in the Behavioral Health Center in Fresno twice, 5150, picked up because of weird things going on. They won't keep her. How do you stop that? How can we get help for her? She won't receive it.
Okay.
That's a great question. And first of all, please thank your daughter for her service. That is, unfortunately, everything you described is far too common. We hear those stories over and over again about the catch-22 that you talk about. One of the things we always do is we want to link up our veterans directly with a doctor who's willing to work with them at length to adjust medications. One of the biggest struggles with our patients is these don't make me feel good, and they really, and many times, are describing side effects that they struggle with. I would continue to advocate for your daughter. Secondly, I would try to get her over to our VA facility. We have a social work department. that is right in line and they're a perfect fit for the situation she's in. We get a social worker attached to her and help her walk through all these situations she's going through, the catch-22, the difficulties with the meds, the housing, all of that. We have individuals who can come alongside and help her walk through that. And when we're done here, I'll give you my card and I will take your call tomorrow and I'll be happy to meet you and we'll get her connected with further care if that's something that would be helpful for you.
And you know, so often we thank our members of the military, but we also should thank the family members who also sacrifice that time without their loved ones. We're going to have to be going to a break, but before we go to a break, we do want to give special thanks to the Center for Advanced Research and Technology, CEO Rick Watson, for allowing us to use this beautiful facility for tonight's town hall. We'll be right back.
You're watching tonight's live town hall meeting, Why Don't We Talk About Mental Health Issues, sponsored by St. Agnes Medical Center and Kingsview Central Valley Suicide Prevention Hotline. We'll be right back. Welcome back to tonight's live town hall meeting, Why Don't We Talk About Mental Health Issues, sponsored by St. Agnes Medical Center and Kingsview Central Valley Suicide Prevention Hotline.
And we're back. Thank you so much again for joining us tonight for our town hall titled, Why Don't We Talk About Mental Health Illness? Text messages continue coming in, and please continue to send us your questions for our panel. That number, 559-426-6474. A lot of these questions are coming with a great sense of urgency. I'll get to one right now. Somebody messaged us, my 64-year-old aunt just tried to commit suicide last Monday. She is scheduled to be released tomorrow. We're having a lot of trouble finding information or resources on how to help her. She has no income and will need someone to watch her 24/7 as she gets severely depressed when she's alone. What type of help is there for older adults who are alone, and are there any programs or grants to assist with the cost of care taking? I will ask Amanda if you can start with that one.
Yes, absolutely. There's a number of programs that specifically target and tailor their services to older adults. And again, as I said about youth and about military individuals, depression looks different in older adults. And a lot of times we see basically a change from their former functioning. And that's the first sign that something is going on. And a lot of people have thought for some time that, well, when people get older, they're going to get depressed, right? Because in our society, we really value youth. But depression is not normal, period. It is not healthy, and it's not okay. So just being older does not mean somebody's going to be depressed. So a lot of older adults are at risk because the depression people ignore, because they assume people are isolated, that's normal, they're older. They're depressed, they're sad, they're lonely for friends. Well, that's normal, they're older. It's not normal. And so people that are older, when they start showing those symptoms, it's very important to get them care very quickly. We know that the highest rate of suicide actually in the United States is middle-aged men, okay? But in California, it's interesting to note that older individuals are at the highest rate of suicide risk in California. And we have an exponential amount of risk and suicide rate in the state of California, especially in our rural communities. So older adults, there are services for them. They are tailored to meet their needs. They're tailored to address the different things that are specific to older adults, right? We find people pushed out of the workforce because they're older. We find people losing friends because they're older, okay? So people start losing their friends, 60s, 70s, friends they've been close to for life, maybe a partner. Those things are really important to know. And if you see a sign, you see somebody you care about changing in their level of functioning, get them help.
Is there where that they can turn, an organization, a website they can go to?
Kingsview Behavioral Health tailors to older adults and serving them, but I would assume, Christina, you as well?
We do. So at the Holistic Cultural and Education Wellness Center, we're not a clinical program. We are a prevention, early intervention program, but we get a lot of people coming through our doors that do have depression and do have anxiety. And so what we try to do is offer different types of diversion activities. So we have things like Zumba and sewing and jewelry making. And what we find is that when we can get people together in a similar space, they create their own support. And so what we find, we have an older person who comes to the center, and she just loves having a sense of purpose. And what she does is she volunteers to make phone calls for us, to remind people of the groups and activities that are coming around. She loves to pick people up to come to the different activities. And then she also likes to organize little taco outings. So once they've sat together for 3 or 4 hours and made jewelry, she invites people to go out and have lunch together. And so it's created this wonderful network where people who maybe were struggling with transportation, she's able to transport them. It gives her a sense of purpose. And she said that when she came in, she was very depressed. And she says, oh, that's gone now.
Now, Amanda, when it comes to programs like yours, is that something that insurance does cover? Because again, this person is saying she doesn't have really any income.
Right. We find that insurance does cover certain programs, prevention and intervention. There are some grants that cover it. And there are probably more prevention intervention programs than there are treatment programs for older adults. And we find the prevention to be very important because we're trying to actually keep someone from developing a mental health diagnosis. But the treatment programs, my understanding is insurance does cover that, but it's still an issue of access, and there's still limitations to that, which is what the problem is. And I want to just add the advocacy piece that we keep talking about, everyone up here has mentioned. The mental health system, unfortunately, forces all of you to be advocates. All people that love someone who is struggling, it forces you to be an advocate, because when someone is mentally ill, by definition, they are not in their best place to advocate for themselves, right? So it really forces us, family members that care about them, to advocate. And unfortunately, what we want to do, of course, is change the system to make it easier so that when someone is not well, they can get the help they need easily.
A question for Trina here. Since you work with youth or around youth, and somebody texted us, do you feel that the high rates of teen pregnancy and teen parenting are a contributor to the rising mental health issues among our young children today? For example, teenagers who are not ready to raise children. In other words, children raising children.
It could be. especially if a child has suffered from trauma. They could be in that situation. I don't know that. I don't have any facts about that, but it could play a role in that.
Okay. We have a question from the audience.
Question from Jose Munoz from Clovis, and you wanted to drive home the issue of difficulty in admitting mental health. What is your question?
It was posed actually to Liz a while earlier, comparing myself. I'm a military, ex-military. I'm a Desert Storm veteran with post-traumatic stress disorder. And the question that is posed is how do we know if this person is having issues? Well, Mr. Silva emphasized, you don't want to let it become to where all the signs are there, but nobody's being proactive about it, being an advocate about it. Myself, it got to the point where I isolated myself. I was in denial. I wasn't doing good in my job. I eventually started drinking, lost interest in work, and it just went downhill from there. Eventually lost my marriage and all that negatively. Was able to get back on my feet, but the point here is that you look for signs, isolating, not talking much, withdrawing, not wanting to have dinner at the table with the rest of the family. If your child comes to you and they're crying or they're very quiet or they just want to be in the room, there's something up. Go check that out. Somehow approach them calmly, one-on-one. Each parent might take a turn in trying to determine what's going on. And an elderly, if they are just not functioning, same thing. They're not showing any interest. They're withdrawn. Same thing. But as a former soldier, I can tell you it is very difficult to admit that you have a problem because you don't know till your practitioner or doctor tells you, you know what, you're broken. I need to fix you, so I'm going to refer you out. And it takes more than counseling and medication. It takes support, not only from your family, but from your friends and the community.
So I guess this goes back to the advocate point. What's our duty in that?
First of all, I really want to thank Jose. Jose, to me, you guys, and I know him, so I'm going to take it a little step further with Jose here. He is what I would describe as a man's man. He is a very strong man. He's a veteran. And a lot of my veterans and men's men, for us to actually say, hey, you know what? I'm going to go reach out and get a little bit of help here. That's a lot, you guys. That is a lot for a guy to say, let me go ahead and reach out and get some, especially for a military man like Jose. If he can do it, you guys, we can all do it, and we can strongly encourage those loved ones around us to say, you know what, it's okay. We have military strong men and women asking for help. He's been through so much, and it lights my heart when I see that young man right over there. And he's going to continue to do what he does. And the greatest thing that we take from a veteran's playbook is that once they feel better, they're not done. They go back, just as they were trained once before, to say, you know what, I got some brothers out there. They need assistance as well. I'm going to go help them and bring them into the VA or wherever they want to get connected for care, because if it can help me, it can help others. So thank you for that, Jose. I appreciate it.
And thank you for your bravery and your service. I can assure you that even admitting you have a problem sometimes takes a lot more bravery than some of the things you faced. Thank you again so much.
There's a whole movement called man therapy. Have you heard about this?
Go for it.
It's awesome. Jose, I don't know if you've heard about this. There's this whole movement called man therapy, and I cannot think of the woman's name who started it. But the whole purpose is to try to talk about how difficult it is for men in particular to talk about mental health issues. And it gives some parameters about what makes that easier, because it is hard for most men to talk about mental health issues. So this whole man therapy is really a movement that is trying to change the culture and make it easier, but to recognize and validate how difficult that is.
Christina, that leads me to a quick question with you, Christina. With your clientele, do you find it's mostly females compared to men?
No, I would say actually in the work that we have, it's a good mix of both.
Great.
Yeah, it is. And what one should always remember is when someone's experiencing mental health challenges, it may not necessarily mean mental illness right away. When we're not feeling well and our mental health has shifted, our emotions are affected, the way we think is affected, and then our behavior is affected. And so sometimes it's hard for us to see that we are not doing well. The best thing that we could have is someone around us who's recognizing that change, to acknowledge the behavior and remind us that it might be hard for us to see what they can see, but telling us what it is they're seeing specifically in the behavior rather than telling us we're sick. because we may not be able to see that. We may not be at a place where we can accept that. So it makes it more difficult for us to really take that next step to get help.
Okay, well, thank you guys so much for, again, the meaningful conversation that we continue. One really quick question, though, somebody asked on text, can you fix anti-socialism?
Oh, that is such a good question.
Or is that a loaded question that we can address after the break?
It is loaded. It is loaded.
Then we'll address that after the break. Again, special thanks to Center for Advanced Research and Technology for allowing us to use this wonderful facility here in Clovis. We'll be right back.
You're watching tonight's live town hall meeting, Why Don't We Talk About Mental Health Issues, sponsored by St. Agnes Medical Center and Kingsview Central Valley Suicide Prevention Hotline. We'll be right back. Welcome back to tonight's live town hall meeting, Why Don't We Talk About Mental Health Issues, sponsored by St. Agnes Medical Center and Kingsview Central Valley Suicide Prevention Hotline.
The issue of mental illness, as you're watching. Thank you so much for joining us again tonight on our town hall regarding mental illness. I want to remind you that this will be broadcasting on Fox 26 Live right now until 7 o'clock, but you can continue the conversation over on KMPH.com where the live stream will continue until 7:30 tonight. Also want you to know that in case you missed any programs that were mentioned or any of the resources that we provided up here along with the numbers on the bottom of the screen, this will be rebroadcast Saturday at 4 p.m. on CW 59. You can also listen to a rebroadcast on KMJ on Saturday, and Valley PBS will also be broadcasting this as well at a date to be determined. Again, we talked about anti-socialism and cures for that. We can briefly get to that, but I know we also want to talk about postpartum depression and overcoming the stigma. Go for it.
What I'd like to share, piggybacking on our participants' comment, is mental health first aid. So we talked about the importance of getting people support. we talked about the importance of recognizing the signs. And so as a family member, if you're interested in taking a class on mental health first aid, they're offered throughout Fresno County in the U.S. You can Google that. You can call me at 255-8395. We'll be offering some classes here soon. I teach in Spanish and English and also teach for veterans. There are also other persons like Miss Chris that teach faith communities. And so it's important that we recognize when something is gone awry, right? So that we can help people get that support that they need. And I know that my colleague here is anxious to talk about antisocial personality. So I will turn the microphone over to her.
Someone asked if antisocial personality disorder, we now call sociopathology, can be cured. And unfortunately, when it goes beyond a childhood, we find that it's much harder, it's more intractable. However, what we do find is that when kiddos are caught early, that there are some sociopathology tendencies. Now remember, you cannot be diagnosed with antisocial personality disorder before the age of 18, right? Because it's a personality disorder. So any personality disorder, you cannot be diagnosed before 18 because we believe that personality is not really finalized or formed until around 18. But we do see signs, and we call that oppositional defiant disorder. We see some behaviors early on, and when we intervene with those kids early, we find that we are able to make a difference. But when someone becomes an adult and has sociopathology, there really has to be, and these happen, miracles to actually change the course of someone's life. And we've seen that. We've seen that in the prisons. We've seen people actually make a different choice, but it's about a culmination of choices. And with people that have sociopathology or antisocial personality disorder, they are lacking the ability to feel empathy for other people. And we know that that's integral to how we form our relationships and to how we care for others. And when you lack empathy, it's very hard not to hurt people, and it's very hard not to use people. Okay, and that's what we see in sociopathology. So it is, most personality disorders, in fact, all of them are viewed as being somewhat intractable. They're viewed as being long-term and enduring.
Okay, we've got about a minute here. Christina, if you don't mind, we were talking even before the broadcast started, postpartum depression. How do you know when it's the point when somebody needs to get help, when you need to get help, when help is needed?
When someone's just not feeling well from a minor symptom, and acknowledging it and speaking up and telling your doctor that something doesn't feel right. A family member offering some additional support and encouraging the new mom to get the help that she may need so that she can feel better and understand what might be happening. There's a lot of changes happening after the birth of a child.
Because you think of the baby blues, but it goes beyond that.
It can, and there's a lot of different things that come with it. But reaching out, speaking up, and being honest with the doctor is one of the important things. But those providers also need to have awareness about signs and symptoms and not asking just a basic question, how do you feel? Many people believe that, and many new moms feel that a baby, I should be happy. And if I feel anything else, I can't tell anyone that because what will someone think of me? And that shame hits, and the shame can keep someone quiet.
Speaking of shame, that's a big reason why we don't talk about mental health issues. We talked about the stigma. We're going to be delving deep into that coming up in the next half hour of this town hall. So we want to encourage you at home, if you've got a computer nearby or your phone, go to kmph.com. You can watch the live stream also on our Facebook page. The live broadcast, again, will only go through 7 o'clock on Fox 26, but you can, again, watch a rebroadcast of it, CW 59 on Saturday at 4 p.m., or listen to rebroadcast on KMJ over the radio on Saturday as well. Want to thank all of our wonderful, wonderful panelists for having joined us, but we're going to continue this going again. Mobile device or computer, kmph.com. We're going to continue the live stream of this on that, and we're going to delve into the issue of the stigma surrounding mental health. What is it that keeps people from feeling that shame when all they need is help? Everybody needs help, and sometimes it's hard to admit it. At least that's what we continue to see over and over again. Thank you so much for joining us again on a live broadcast here on Fox 26, but we'll continue over on kmph.com and the Fox 26 Facebook page. Thanks again to Center for Advanced Research and Technology for allowing us to use the facility, and Fresno County Superintendent of Schools, Jim Jovino, for helping to start this conversation tonight. And welcome back live as we continue to have this discussion, our town hall tonight on why don't we talk about mental health issues. Again, we mentioned you can watch on Fox 26, on KMPH.com, on the Fox 26 Facebook page, or you can also watch the live stream on our app here at the Fox 26 app that we have available online. Again, we're going to reintroduce our panel. If you're just joining us, Christina Roop is the Executive Director of NAMI Fresno. We've got Jerry Silva, who's the Lead Suicide Prevention Coordinator and REACH Vet Coordinator at the Veterans Administration. I've got Trina Frazier, who is the Chief Student Services Officer for Fresno County Superintendent of Schools. I've got Amanda Nugent-Divine, who is the CEO of Kingsview Corporation, and Cristina Alejo, who is the Program Director at the Holistic Cultural and Education Wellness Center. The topic, again, why don't we talk about mental health issues? There's a big stigma attached to it. Whoever wants, this is a free-for-all.
I think I'll jump in. I was sitting with a group of coworkers a while back, and we've all been in the field for many years as licensed providers, and we were thinking about what if we could invent the smallest, tiniest instruments that look like a little tiny scalpel, a little chisel. They're smaller than your fingernails. And these are no-hurt, invisible little instruments. So I can reach over to all the people out there and carve your vision out just perfectly how I want you to see me. Because your perception of me and my appearance is so important, and I want to belong so much, that let me carve this out exactly how I want you to see me. Because if I were to tell you just for a minute that I struggle with depression or anxiety or struggle with PTSD, your first thoughts of me and your impressions of me are going to just go lower. And so now that means I'm less than, I'm weak, I'm not as good as, I struggle. And for years, taking my son to school, I would watch parents have their discussions with one another about Joey at school or Cindy in soccer practice. But the one time somebody would say, well, you know, Mikey, I have to take him to his counselor because he has mental health, everybody stopped. All the parents' conversation stopped, and everybody turns over to that conversation. Oh, what happened to him? Is he okay? Something's bad or wrong now. And this is especially prevalent right here in the San Joaquin Valley. We are the second most poverty-stricken region in the country. We're diverse, and everybody has this extra alertness about them. Say, what do they look like? And, oh, I knew it, they struggle with. So even discussing mental health right up front is a bad thing. It's negative, it's wrong, you're lower than, you're weaker than. So I better just keep it to myself, hold it in, because I wouldn't want you to think of me as less than. So the stigma that goes along with that, along with the history that's come along with mental health to this day, is deep, it's entrenched, and it's sad, you guys, because the fact of the matter is the very individuals you're trying to carve out their perceptions, guess what? They have issues too.
I think one of the biggest barriers that we're facing is the stigma and sometimes the shame around mental health. We have to educate everyone. We have to educate our youth. We have to educate our parents, our adults. We have to talk about it because we have to. It's going to take all of us, our entire community, to break down the walls right now that we're seeing around mental health. It's going to take all of us because the stigma and the shame is just so high. It's like Jim said, we talk about everything else, but when it comes to mental health, we don't talk about it, and we have to start talking about it and learning about it and the facts. And you know, why does it exist? What do we do about it? All those different types of things. But it's going to take all of us as a community to be able to do that.
Mental illness is not we refer to it as not a casserole illness. When someone is diagnosed with cancer, people show up with meals. If someone has another physical injury of some sort, people are sending get well cards and flowers and balloons. This journey is long and exhausting and can drain family members of time, energy, and financial resources. No one's dropping off a meal for anybody who can't be at home to prepare. No one's helping with any expenses because their loved one had to leave the county to be cared for. And if we embrace that we can all make a difference and contribute to the quality of life for people who are impacted, we may be able to open up and speak up about it. Instead, we tend to keep it to ourselves. Sometimes it's very vulnerable to open up and share that you have a mental health challenge and that you're struggling. Your integrity becomes questioned. Your credibility is questioned. There are unkind people in our world who will take some of that knowledge and not use it in a positive way. We speak about mental illness. Sometimes people think it's funny the way we talk about medication or the way someone has different behavior. And we don't realize that someone is in a lot of pain living with that. And so we have to model better behavior. We have to do better ourselves, and we have to hold others accountable when we see it differently, so that way we can start to make a difference.
I mean, we talk so much about the buddy approach at school. You know, when a new student comes in, you want to be that person's buddy. That more often, I guess it might help if, as individuals ourselves, we ask, are you doing all right? Something as simple as that. Would something like that make a difference?
I think that's exactly right. I think we need to normalize talking about mental health, but not necessarily in those terms. So we found at the center that one of our largest sources of mental health referrals is actually someone who works on PG&E assistance. So you know how when you call into PG&E or you call a helpline of some sort, you're put on hold for extended periods of time? Well, what do you think happens in that downtime? The people start sharing about, well, we're having a hard time paying our PG&E because this is going on and that's going on. You know, we're having marital problems. They start sharing. And the person gets to spend quite a bit of time with them and gets to learn about their story. And so as you learn about the person, and that's why we call it the Holistic Center, we're looking at the whole person and we're talking to them about what their needs are. In there, you might find embedded mental health needs, but we're the ones that need to identify that, not the person, right? Because it's not fair that because the person can't put the label of mental health on their symptoms, that they not get mental health support. Also, when we offer mental health resources, do people in the community understand what that means? We had, let me share one quick example with you. We have a Spanish language support group where we talk about everything. We identified several people in there that could benefit from mental health services, clinical mental health services. We offered them. They said, no, we don't need that. We're not crazy, right? So we saw this pattern over and over. And so I thought, my goodness, how are we going to get these women the support that they need if they won't see someone else? They said, I'm fine just coming here and talking. And so I thought about, what is the issue here? Is the issue that they're scared about therapy? Is the issue that they don't know what to expect? Are they worried about cost? What is it? And so I thought about the traditional barriers to care, right? Transportation. So I thought, okay, let me remove that barrier. Proximity to care. Let me remove that barrier. Language. Okay, let me find someone who speaks Spanish. And knowledge about where to seek services. And so what I did is I thought of the friendliest Spanish-speaking therapist I could think of, and I invited her to the group, and they just met her by name, and they got to ask her a ton of questions. Guess what? By the end of the session, we had people asking if they could see her. I offered up my office at the center. I said, hey, if you guys want to make appointments and come on by, I'll let her use my office. You can do it here. So more than half of the people went to her to talk to her about problems. Did they know they were seeking mental health services? Not necessarily. Would they identify as having a mental health disorder? Not necessarily. They just knew that somebody was there that had information, that was willing to help, and they had access.
And the text message, by the way, keep coming in, but we're going to take a question from our audience.
So we have a question from Zena Brown-Jenkins from Clovis, and she's asking about the adequacy of mental health providers when they're intaking somebody that needs help. What was your experience?
And with my experience, 4.5 years ago, my son-in-law went into a facility here in Fresno. He felt he just wasn't feeling himself, is what he said to us. Anyway, the person that met him and did the intake, I felt probably wasn't the right person to take his information, because unfortunately he went home and he passed away. And so I read the information that she had wrote down, she hand wrote down. She was a nurse. She wasn't what I consider a professional person to diagnose that he said he was hearing voices. And on top of that, my son-in-law has schizophrenia and Tourette's. So long story short for me, now I am raising his 6 sons. And it's very important for me to understand all of this. And yes, I am their advocate. Trust and believe I am. Because I'm looking at children from 9 months old up to 10 years old. And one of those children are going to have some issues. And again, I say, what is the intake process? You say that there's all these facilities out there for people that need the help, and yet and still, it's not the right people that are taking the information down and sending someone like my son-in-law home.
Did he go to a facility or did he go to a hospital?
He actually went into a facility, one that he knew of. And like I said, I read the information, it was handwritten. The person said that he was not harmful to himself.
Okay, anybody?
There, unfortunately, and first of all, I'm very, very sorry to hear that. It sounds extremely painful. And the upsetting thing is that just because there are many, resources or facilities doesn't mean they're good. Doesn't mean they're all good. And it doesn't mean that every person that works at a particularly good place that provides good services may be good as well. And intake is so important. It's the first step. So we put a lot of time and energy into our intake process to make sure it's one where someone is compassionate, they're listening, they're paying attention. But again, this goes back to, and I have to say, anybody that has somebody in their family that they love that suffers from mental illness, it really, the biggest burden is on you because you are literally trying to fight for the life of the person you love, because you cannot take no for an answer. And you cannot take an inadequate, offering for an answer. You have to keep going. And I know that's not a great answer, but people run into that all the time. There was a senator, I believe it was North Carolina, I don't know if you guys remember, his son suffered from schizophrenia. He was in an active psychotic episode. His father, a senator, took him into the emergency room and said, I need treatment for my son. He is threatening to kill me and everyone else. You have to help him. And they said, we have no beds. Bring him back later. There are no beds. He went home and he stabbed his father in the face, and not to be horrific here, but to just be honest, and then he killed himself. And so his father, as you can imagine, loving him, was most upset about the fact that he lost his son. And that happens way too much because we're not listening. We don't have the excellent services we need. We are striving for that at Kingsview. We value that. I know everybody up here with me values that, but we have to get better.
So is that, not to interrupt you, but is that one of those things where if one place turns you down, try another?
You go to another, you don't take no for an answer. You go back into the ER, and if they send you home and they say he's fine, we don't think he's going to hurt anybody, but you know your son and you know he is and he's not okay, or your son tells you, there are people that suffer from schizophrenia that will tell you, I'm not okay, I'm not safe. Don't let me leave. I can't promise that I'll be safe. And then you take them to another ER. Do not give up, or you ask to speak to the chief of the hospital. Fight, and do not take no for an answer.
Do we know if there's any sort of disconnect between the mental health community and, like, for example, emergency departments? Because even the story that I did last night, the gentleman had taken his wife again to the ER twice, or the ED twice, and was told she should be fine, just go back home.
There is stigma in the emergency departments, and we have ERs and emergency departments that are amazing, and they're wonderful at trauma. They do not like for people to come in that have mental illness. And we have done a great disservice. Back in the 80s, when we sent all these people that were individuals and were hospitalized into the community, it was for a good reason. We believe that community is where people can heal. We don't want people to be institutionalized. But what we have failed to do is provide adequate places for people to be hospitalized when they need to be kept safe for a period of time to stabilize, and that's what is broken in the system now.
A wonderful thing about Fresno County Office of Education is you guys cover such a large area. Superintendent Ovino talked about that. Somebody texted us, I've got a 15-year-old that's being treated for depression and anxiety. She's on her second medication. She was on Lexapro, but it made her suicidal. She also sees a therapist weekly, but struggles daily with sadness and often feeling like life is too much. Are there any youth groups here in the Valley that maybe she can turn to?
We're actually starting some youth groups through our partnership with Fresno County Behavioral Health. One of the really most important things we are finding is that on these interagency team meetings is to include the youth. Sometimes they're much more likely to talk to their peers. Yes, yep. Than they are to adults. And so we're really finding that bringing the youth in and having them be a part of that is really, really important. And like you said, the person in the audience that asked about staffing and finding the right staff, it is so important to find the right staff. As we go through the interviewing process, We are really looking for people who really want to work with students, children, young adults, who want to work in schools. They don't mind traveling, because our county is very large. And so they don't mind traveling, but really finding that ideal staff who want to work with our youth and our children is really, really important.
Any other?
If I may add to that, for those of us that are working on staffing our mental health locations and our prevention early intervention locations, it's really important to consider who you have at the front desk. I've talked to many people that have not gotten through the doors to those great clinicians because a secretary is rude or because somebody in the front office did not treat them properly and they didn't feel welcome, so they didn't come back. So as we're working on staffing, it's very important to consider frontline staff as well.
Just one quick thing I'd like to add, Liz, is how many here, when you're in search of a good restaurant or a good movie, you go on Yelp and you do reviews, right? You want to check out for that, right? I know you do. If we do that for our dinners or for movies or for entertainment, how much more value should we do that as we're looking for a competent licensed provider, especially with our loved ones' care? For years, I've spent time supervising licensed clinicians, and the fact of the matter is we're all at different levels of competency, right? I get new grads right out of graduate school, and they're all fired up, ready to go, and I'm not going to place you with the most difficult to serve patients. You're just not ready yet. So before you send those loved ones for care, do your research. Do the reviews on that. That's significantly more important than our meals and our entertainment. Reviews are out there on licensed providers. Guys, let's all do our research and check and do the homework. Make sure that we're getting our loved ones connected with competent workers.
Okay, we have a question from the audience.
Question from Chris Smith from Clovis. What is your question?
My question is, what do you do if Fresno State University is running a psychological program on behavioral manipulation and they use the community against individuals like they're doing to myself, a 14-year veteran of this country, and I don't get so much as a look from people, nothing. I throw knives out in front of my house every day just to get attention, just to see if people will approach me, and they don't. Everybody just judges me and spreads rumors, smuts you up, they're driving me into debt, and it's like, man, this is my hometown. But it don't feel like much of a hometown at all. And you want to talk about mental health, it's not mental health if something's really happening to these people, because it is. Our police chief and the law enforcement are not good people. They're not doing the right thing. No, most of the people in this town are not doing the right thing.
First of all, thank you for your service. Jerry.
Chris, I'm really sorry to hear that report. One of the things the VA rolled out, I want to say about 2 years ago now, is we are required nationwide to do what's called the public health approach to mental health and suicide prevention. And one of the first tenets of that is to partner up with universities and colleges. Our team has gone out every semester to teach. We're on syllabus out there. We got semesters to go out and teach the students, to the veterans in particular. And when I get a feedback like that, it's very upsetting. Once we're done here, I am going to give you my card because there's some individuals that are key points of contact at state. I'd like to make sure that they receive your report because it's not okay. Everybody needs to be served that have mental health issues. I have a particular bias, obviously, towards veterans because of all the things you guys have done for us. You guys have given us an opportunity to have jobs. So I am going to exchange some info with you, and I want to make sure that you get the right level of care and get you connected in the right way. So hopefully that will be helpful.
Thank you very much. Thank you. I've got a question here. I'll direct this one at Christina Roop. Somebody said, I'm currently off my antidepressants and I feel the effects every day kicking in, such as uncontrollable sadness, panic attacks. I'm going to get back on my meds, but I don't want to depend on them for the rest of my life. What solutions are there other than therapy?
I think having a very honest conversation with the individual's current provider and expressing the desire to find a way to possibly not have them. However, having an honest conversation with themselves as well, that may be what they accept. But there are other things that can be done to complement one's mental health. Healthy coping, exercise, a healthy diet is extremely important. Taking a look at how they sleep. Are they getting enough sleep? Interaction with others, activities that they do enjoy doing that could make them feel better to help improve their wellness.
You talked about healthy diet. Please elaborate. We'd love to know more about this because this is something that can help everybody. I mean, you don't think about what you're serving yourself can play a role.
Oh, absolutely. When we're doing well, we tend to do a few things regularly. We move our bodies, so we have some form of exercise in our daily routine or weekly routine. We eat pretty well. We regularly, and the food is nutritional for us. And we sleep well, and then we engage in activities that we enjoy, whether those are friendships, hobbies, interaction, different types of things that someone would enjoy doing. But when life takes over, gets a little bit busy, or something comes our way that may be difficult, stress happens in our life. How many in the room don't have any stress in their life?
For you stress, eat.
And so we can enjoy some fun food every so often, but when we continue to do that, it doesn't sustain us very well, and our mental health will be affected by that.
Are there any foods that are considered mood lifters?
Chocolate.
Chocolate actually increases serotonin.
Chocolate for everyone.
And dopamine. I mean, that's all. Yeah, we could eat chocolate all day long if that would actually not crash us and then reduce serotonin. That's the problem. It gives you a boost, but it's a very temporary spike, and then it actually crashes, and you feel worse.
When we're not doing well, we aren't sleeping well, we probably aren't engaging in some of those activities that would bring us joy and help us feel better, happy. And we're not eating well. And when we give up some of those things, it will affect the way we feel.
Domino effect. We've got another question from the audience.
Yes, from Phil Neufeld from Fresno. He is asking a question on whether technology plays into mental health.
Yeah, I've noticed when with students that a lot of them aren't necessarily connecting with their phones when they're walking together. They might be connecting with other folks. So how might technology help us create healthier connections and better well-being, and how does it get in the way? And then also from a system standpoint, how might we work together to have better information sharing and better knowledge across our different systems and ways to help people better?
I would love to. I'm actually in a doctorate program right now studying psychology and technology, and the research right now that is coming out on the fact that we have a whole new generation that's raised in a digital age, right? And there are positives. There are absolutely positives. People are connecting. They stay sort of 24/7 connected to their friends. The problem is they also there's a broader means by which people are shamed and bullied. And there is a new sort of cultural norm of sharing very personal things on social media. And we know, we learn. Yes.
And then they delete the posts.
And then they delete the posts, but it's out there and it's spread around. And so that shame and that ridicule, I think our kids today are dealing with a whole different level of ridicule and shame and embarrassment than we did when technology was not a part of our world. But again, I believe there's many, many positive things that have to do with technology, and I believe that we have to start incorporating it into our treatment modalities to reach kids, because kids see things through a digital lens, and that's just the way it is now. The day of non-digital world is gone. We are looking ahead.
I think I would add just the downside to that is they've done studies with, one of the studies was titled CPA, which stands for Continuous Partial Attention. So what happens is now there's a lasting effect. Once I mean, all I see all day long, whether it's colleagues or students, everybody is just constantly on their phones. My bosses are like that. So if I'm thinking I'm going to have a conversation with you, even after you've put your phone down, there's still this lasting effect. So I miss the days when we can just have no clutter, no distractions, just a face-to-face check-in, heart-to-heart talk. And it's sad that those have gone by the wayside, but there is definitely downsides to that. So maybe there's something to be said about a healthy balance, but I would always be mindful about maybe at some point setting the devices down to have a talk.
I'm going to piggyback on his question. How much does the instant gratification play a role in mental illness? Because we see somebody post something on Instagram, and 3 minutes later they're like, nobody's liking my comment, my post, nobody's liking this. Is that affecting?
We've been able to use technology to help us. at the center. So I can give you an example. When we were working with our Punjabi males, what we found were that there were a lot of truck drivers. And so there was a lot of isolation and disconnect. And so there were a lot of things happening, like they said, back home. And so we started a texting support group for the truck drivers. And so when the truck drivers were in town, they could organize these soccer matches. And when they were away, they were staying connected through text. And so for us, we've been able to leverage that as a positive thing. And actually, it encouraged dialogue among the truck drivers because there was a little bit of a sense of anonymity. They didn't have to speak face to face. And so for us, that worked well.
And I mentioned, again, the instant gratification, and I saw that, Amanda, you immediately nodded about that.
Yes, and again, this whole new generation is expecting feedback, and they're looking for. We know that as we develop our personality and as we develop our sense of self, we are looking. It's called the looking glass self, is actually what it's called, and that's because we look to other people as we're growing to get a sense of who we are. How do people respond to us? Do people think we're funny? Well, then we start believing we're a funny person with a great sense of humor. Do people react to us and raise their eyebrows like we're really smart? Well, we start feeling like, hey, I have a high intellect. I think I'm really smart. The looking glass self is how we kind of form our concept. And the kiddos are still doing that, but they're doing that through social media. So there's actually been a study that showed an increase in depression and anxiety correlating to the lack of response on social media to their post. So they are monitoring their post. As you said, they'll post and immediately look at who's responding and what are they saying. And when they don't respond and they don't say things that are positive, they will literally take that and internalize it as something that is flawed about them.
Okay, I'm being told we've got a couple of minutes to go, so if I can go through each of you and I'll pose this question. When it comes to the stigma, or just why don't we talk about mental health, where were we 10 to 15 years ago that we've managed to get to where we are now, and what do you expect next? I'll start with you.
Where were we 10 to 15 years ago? I think many people were lost and didn't really know what to do. I think we've done some improvement. We have definitely created awareness in our communities because we're having activities such as this forum to have the conversation. We can still improve on that. I think key pieces to doing that is education, learning signs and symptoms, knowing what healthy mental health looks like, knowing what it looks like when it's changing and where the resources are, and sharing that, whether you're healthy and happy to do it. If you're struggling and you've had the experience and you've lived through it, being open and having the courage to share that with others can help make a big difference in someone else's life.
Jerry, what do you think has been the biggest takeaway for tonight?
One of the biggest takeaways is just the fact that we can have the conversation. It's been so cool just to talk about it and to say, hey, it's okay. In fact, not only is it okay, it's encouraged. And the more that you are willing to risk being vulnerable yourself, the more you're going to make those loved ones feel it's okay.
Trina, what is the takeaway for parents and for teenagers who may be watching?
I think that we just have to keep talking about it. We have to keep educating. We have to have no wrong door policies where there's access for everyone. It shouldn't matter your eligibility. It shouldn't matter if you have Medi-Cal. It shouldn't matter if you have private insurance. It shouldn't matter if you have no insurance. It shouldn't matter if you're undocumented. There should be no wrong door for our youth.
Amanda?
I would say that stigma is alive and well, but we've come a long way and we have further to go. And I would just ask anybody who's listening or watching that has mental health issues or who has mental illness or loves someone that does, please know that you are not your illness. You are not your mental health issues. I want you to think of it in terms of like having diabetes, and especially as far as taking medicine. That stigma is still alive when I hear people not wanting to take medicine or I don't want to be dependent on it forever. It is looked at as a negative, but we don't judge anybody for taking insulin every day because they are a diabetic. So it's very important that we begin to objectify mental health issues like depression. Depression has a job, and depression's job is to distort your perception, to make you think you are worthless, to make you think tomorrow will not be better, and to make you think nothing can ever change. And that's its job. And when we think of it that way, it is easier to fight it because it is a battle, but we're all with you.
I think the takeaway message is to know that if you're battling with a mental health disorder or you're having mental health challenges, that you're not alone. If you look across this panel, you'll see many caring people that want to help. If a place like Fresno County Behavioral Health or Kingsview or a hospital is scary, I encourage you to go to your primary care physician or come to a drop-in center like the Holistic Center and just start talking to people about how you're feeling. You don't have to use the terms mental health. You don't have to say you're depressed. Come in and just talk about your day, and we'll figure out how we can help you.
I think one big takeaway also is that if you have a family member, advocate for them, and don't take no for an answer, even if you hear it over and over again. That was a big takeaway as well. We thank you all so much for joining us tonight again, and thank you at home for also watching. If you've been joining us for this last hour and a half, thank you so much for this investment in your family's well-being and your well-being as well. We hope again that we've been able to provide you some answers, some ideas, or at least get the ball rolling. Maybe you've seen a phone number at the bottom of the screen that caught your attention. And we again will be broadcasting this one more time Saturday at 4 p.m. on CW 59. This will also be rebroadcast, at least the audio will, over on KMJ on Saturday, and it will be broadcast and shown later on Valley Public Television at a date to be determined. One more time, special thanks to the Center for Advanced Research and Technology for allowing us to use this facility, and also special thanks to Fresno County Superintendent of Schools Jim Jovino for getting this conversation started and helping to inspire our town hall today. Again, our town hall, why don't we talk about mental health issues? We've been talking about it tonight. We hope that you continue the conversation at home. From all of us here at Fox 26 News, we wish you a good night, and thank you again for your time.